as we see, 90% of the patients will be asymptomatic, will be fine, nothing will happen. Only fetal monitoring after 2 weeks for growth and Doppler. Now, what a little bit more about antenatal contacts. If the patient is positive and she was asymptomatic, but she doesn't need to have her routine antenatal checkup, we can just have a growth of the fetus after 2 weeks. But additional care is required if there are any other complications. Now, if the patient was symptomatic, so this was the situation when the patient did not have any symptoms. Now, if the patient was symptomatic, the patient needs to be hospitalized and then severely and then intensively monitored by something called maternal early warning criteria, or a quick sequential organ failure assessment tool, in which you just see the BP, respiratory rate, and consciousness. If 2 out of 3 is abnormal, then she would require an ICU admission. And if the patient is actually in shock or organ failure, she might require an urgent delivery also. So these are the ladies who would actually require attention, and also a lot of attention, and also delivery, urgent delivery. Now, if you have admitted these patients, a close surveillance with temperature, chest imaging, oxygen therapy, and oral hydration would be required. Screen for other viral infection and consider empiric treatment. Now, currently the treatment prophylaxis is not very clear. There might be a role of antimalarial, antiviral, but currently it is not really verified and evidence based on all these issues. Fetal heart rate surveillance, FHR and daily fetal movement count, antenatal corticosteroids need to be, if we are expecting that the lady would deliver and she really needs corticosteroid, then we really need to, balance the risk of infection versus giving the risk of prematurity. So we need to think about it. Now, antenatal contact after she has recovered from illness, then if it's in the first trimester, you can offer her the second trimester normally scan, and recovery from in the second half, then we need to advise the fetal growth after 2 weeks. So for antenatal care, the pregnant woman should follow the same recommendation as non-pregnant for avoiding exposure. Antenatal care for teleconferencing and video conferencing is the key to provide quality care during pandemic. Triage based on symptom severity and obstetric emergency, multidisciplinary approach to management of suspected and confirmed cases. Now, this was the first part where we discussed about the antenatal care. Now, in a shorter span, I would like to discuss the important aspects of labor and delivery with suspected or confirmed COVID-19. Now, whatever, as I've mentioned before or not, COVID or no COVID, all women have the right to safe and a positive childbirth experience, whether they have a confirmed COVID-19, with respect and dignity, companion of choice, clear communication with maternity staff, and pain relief strategies, and mobility and labor where possible. So I think this was the poster given by WHO, and I think this stands true that we really need to take care of. So the advice that we need to give to pregnant women is call the maternity unit in advance. The worst thing that we can do to the pregnant woman and to the healthcare facility is an unplanned arrival of a positive mother in a facility. So again and again during the antenatal care, we should insist that keep the phone numbers. I think everybody has phone now. So keep the phone numbers and call your healthcare facility that, okay, this is what is needed, and restrict the number of attendants. Now, any facility, these are the 5 principles that need to be in place to prepare any facility for a labor and delivery or management of a COVID suspect or a COVID positive pregnant woman. So first of all, SOP, second is infrastructure, third is personnel, fourth is PP, and fifth is infection control practices. So these are the 5 principles of management of any facility, whether big or small. Every facility should have standard operating procedures. See, guidelines are available by various societies. We are not talking about guidelines here. Every facility should have a written policy. Even if it's a 2-room PHC or a 3-room a BMOC facility, it should be written that where a patient is going to enter from, where the patient will go, and what is the referral policy. So the SOP should be laid down in writing and should be printed, and it should be pasted on the in the facility. So the first thing is making an SOP. The second is infrastructure. Now, you don't need a very heavy building or anything, but most importantly, you need to identify a place, because this is different from what we are used to. Everybody used to walk into a labor room where, anybody would see the patient. Now there has to be a triage room where a suspect would be screened first, and if you are a suspect, you would be placed in an isolation room. So you need a triage room, you need a delivery room. So a BMOC facility should at least have a single room for a delivery of a suspect. If it is not having a cesarean facility, at least have a delivery room for a suspect. So when I say infrastructure, you don't need a big building. You need to reorganize your place in such a manner that there is a unidirectional flow of the patient from the point of entry to the point of segregation to the point of placement of that patient in an isolated room. When I say isolated room, we cannot have that room of isolation sharing the same air conditioner with the other room where the not with where the negative patients are lying down. So I think that is the only requirement. Just place a patient in another room. So a separate delivery room for suspect and confirmed, and the neonatal resuscitation corner should be 2 meters away from the delivery room. So this is a facility that we created in AIMS almost 1 week before our first patient came in. So we were kind of prepared. So we converted our OPD area into the new facility for suspect cases. So, and we marked these areas for the patient entry and the doctor's entry. Now, most important part of any COVID facility is your personnel or the people. So we need to train all the staff in the use of PPE, rotate the staff so that not everybody is on duty at all times, conduct mock drills. Mock drills is very important so that they know that if a patient comes, which room she will go into. Your teams will change, but the mock drills will at least tell them that, okay, this patient comes, this is the room she's going to go into, this is the place where the things are kept for a suspect delivery and a normal delivery. So COVID response team should be ready at all times. PPE is another very important aspect of management, and adequate PPE should be available. However, rational use of PPE should also be maintained. Like in triage, you don't need a level 3 PPE where you are sitting in coveralls. But at the same time, if you're in a labor room or doing a cesarean section, you would need a level 3 PPE. But most importantly, what we need to understand as gynecologists are that COVID-19 is a respiratory infection. The transmission is occurring through respiratory route. So if we are wearing a mask and a face shield, and we are wearing a impermeable gown and gloves and boots, we are protected. So we don't need a Tyvek suit or a coverall for or an asymptomatic patient, right? So we need to really understand the mode of transmission. If we are actually conducting a delivery of an asymptomatic patient who's screened negative clinically, we can just cover our face with an mask, good N95 preferably if it is available, and a face shield. So that will provide good protection. So in our unit, it is our, we do not do universal testing as of now because it's not available. We do a clinical screening, and if she's asymptomatic, we take them in our normal labor room. And but in the normal labor room, we are not using level 3 PPEs or level 2 PPEs. What we are actually doing is using N95 masks and face shields and using impermeable gowns. We are not using coveralls, but gowns with gloves and boots. So I think this is what we are doing right now. So this is the level 1 and level 2 PPE that we are talking about. So in an asymptomatic woman, which is in a non-COVID area, we are essentially using level 1 PPEs only, however, with face shield. So face shield and N95 is the most important component of PPE when you are dealing with a respiratory infection. So rational use of PPE remains most important. So for labor and delivery, level 2 kits with face shield, and for cesarean section, level 3. So this is for a COVID positive woman. So level 3 would be a coverall or a it's the how we. So this is actually taken from the AIMS manual which we have for the HICC hospital infection control team, and how we have defined level 2 and level 3 are essentially recyclable material used that we use. So the typically the Tyvek suits and all. So this is the level 3 which is used for cesarean section, and the level 2 is based on the gown based material. Now, for the infection control practices, this is the most important thing. Another thing which it is, how do we dispose of our PPEs? That is very important to understand. The bins and all should be marked, and the disposal should be very good. And disinfectant for the room in which the patient is staying is using 1% sodium hypochlorite or 70% alcohol. And once the patient has been shifted out, then the fogging should be done. So, for example, the OT after which you have operated, we can use the fogging with 20% with H2O2, use based disinfectant, and after that 30 minutes of contact, and the room is closed for 45 minutes. Now the question of birth companion is preferably avoided, but if you want it, then the attendant should be screened properly, and if the attendant looks negative, then you can allow the birth companion. Mode of delivery, there is no evidence to favor one over the other. They might very well undergo a normal delivery. And actually, what is happening in our neighboring medical colleges, where the load of the positive mothers are actually very high, that it takes so much time to actually prepare for a cesarean, that, and patients who are in labor, they are delivering normally and going home normally. So it is not influenced unless woman's respiratory condition demands urgent delivery. So counsel consider women's preferences, and cesarean section is only when medically justified and the obstetric practice. Birthing pools should be avoided. Now, there should not, if the induction of labor cannot be safely delayed, the general advice for COVID-19 should be followed, and the woman should be admitted into isolation room. So again, COVID-19 is not an indication for delivery. Try to delay the induction if there is an active infection. If, however, it's not possible, take the usual precautions. So, timing of delivery is not dictated by the presence of COVID 19. If the infection had occurred in early pregnancy, then there will be no alteration in the timing of delivery. If the infection occurred in third trimester, it is reasonable to postpone delivery till the negative test is obtained or the quarantine status is limited. If, however, the lady is critically ill, and if we feel that the delivery will actually improve the condition, then it might be a reason to deliver the lady. Now, are we screening a pregnant patient before a planned delivery? Well, asymptomatic till yesterday, we were actually screening all the patients who are coming from hotspot requiring admission. But we are in a fix right now, that because ICMR guidelines yesterday say that even hotspots may not be tested unless symptomatic. So we are in a fix right now, but till now we were testing the symptomatic, yes, all of them, on asymptomatic patients from the hotspots requiring admission to a healthcare facility should be tested. So I think, but individual states can have their own protocols depending on the availability of the testing. So for a woman in labor, right, so the initial point of contact and triage remains the same. After you have screened, give the woman a surgical mask. Again, assess for the suspected cases. If the woman is not in labor, no high risk, send her home. If the woman remains, needs admission, admit the patient, let her undergo testing, and then the labor monitoring should be done by intense monitoring of pulse, respiratory rate, BP, oxygen, and the fetal continuous CTG needs to be done in labor. Again, after assessment, you think the patient is not in labor, it was a false labor, then you can send the patient home on an advice to look out for leaking PV, bleeding PV, pain, and decreased fetal movements. If, however, the labor is confirmed, then continue the monitoring in labor as per standard practice, maintain oxygen saturation. And as I mentioned before, majority will not have any problems, and a few will develop complications. And again, assess them using the quick SOFA score, and if they develop complications, shift them to the ICU. Clinically, fetal monitoring should be continued with continued CTG. Management of labor is not altered. However, person to person contact should be limited. So no hearing the fetal heart with a stethoscope, prefer to have a CTG. Time in labor should be limited. I would not say that, no stethoscope. I mean, we need to really individualize on available facilities. I cannot say that. Whatever facility you have, please use them. Time in the labor should be limited. And as I said, it is not detected in vaginal secretions, so ARM can be done. Tocolysis should be avoided, and avoid, because it's a systemic disease, so avoid giving tocolysis. If the patient has gone into preterm labor, she will deliver. Spinal anesthesia or a regional anesthesia is preferred because general anesthesia is considered to be aerosol generating. Delayed cord clamping can be done. Breastfeeding can be done. Most of our neonatologists are advising breastfeeding with respiratory precautions. So practice respiratory hygiene, do hand wash, routinely clean and disinfect the surface. If the woman is unwell, then maybe we could do express milk and give the baby relactation and donor human milk by a milk bank. So all facilities should have preparedness to handle suspect and confirmed women. So this is something that is essential. Even if you are not a COVID positive facility, every facility which is catering a vaginal delivery should be able to handle a suspect. So should have an isolation room, because a patient comes in labor, we are very special in the sense that there is an emergency waiting for us to happen anytime. So every facility should be enabled to handle a suspect till the time that report comes, and I am sure the state is doing a great job of it. All women despite pandemic have a right to safe and positive childbirth experience. Principles of labor and delivery management remain, except that facility for isolation should be there for safety of pregnant women and healthcare providers. Breastfeeding should be encouraged in eligible neonates. So these are some of the guidelines which are available, and they are increasing by the day. So again, I don't think stay home and stay safe applies for healthcare providers. But thank you very much, and I would be happy to take the questions.
Thank you, Dr. Aparna. We didn't know you were from Andhra Pradesh, so a special welcome from Andhra Pradesh. And I think, I hope that this is the beginning of a very long-standing relationship with this state.
Yes, I'm really happy to be. Actually, I sent the invite to my father. The first thing I did yesterday when I got that mail is I sent that invite to my father, and he was really happy.
Wow, great. Thank you. Dr. Aparna has really shared with us very critical aspects. Hardly any vertical transmission. If both the doctor and pregnant women are wearing a mask, and if you maintain a distance of 1 meter, the chances of transfer of infection are almost minimal. Less than 1.5% is what she said, I believe. She's also given a very important 5 principle advice based on 5 principles to all the healthcare providers here, healthcare facility providers, all the gynecologists and obstetricians. We focus on SOPs, we focus on triage, isolation, we focus on training our healthcare personnel, we focus on PPE, and we focus on infection prevention. And then she's also shared that this is not an indication by itself for C-section, and that all facilities, no matter a COVID or a non-COVID facility, should be prepared to handle a suspect or a positive COVID pregnant woman. So given that context, you remember we had a poll when we started off, and this is for our audience. We had 53% of y'all had questions regarding pregnancy and COVID-19. And I think, I'm sure you all have actually got answers to some of your questions in the last 2 presentations. But if you still have questions, please feel free to type them in the chat box. We will take your questions after the next presentation. So we've heard all of this advice, but if you really want everything at your fingertips, you want it at the click of a button, then we have something called as the Safe Delivery app. And I request Dr. Tarun to take us through the Safe Delivery app and the COVID-19 module of the Safe Delivery app. Dr. Tarun is the country director for the Maternity Foundation. And may I hand over to Dr. Tarun, please? Thank you. Hello, Dr. Tarun. We are not really able to hear you right now.
Yeah, so good afternoon to everyone. And first of all, I want to thank Government of Andhra Pradesh, Dr. Geeta for inviting us, and the UNICEF, Dr. Sanjeev, Dr. Salima and Nagendra for organizing this event. And today, my talk is on the Safe Delivery app, which is a tech-based platform launched by Government of India. And we are working from last 1.5 years, more than that actually, to improve the maternal health trainings through this digital platform. So I will just take you through the COVID-19 specific module, but all the modules in the Safe Delivery app have similar structure and you can access those also. So can you see my screen, Salima? Can you see my screen?
Dr. Tarun, we're only able to see your folder, not your presentation. Can you
Okay,
do a screen
okay.
share again? Yeah.
Sure, sure. I'll just change it. I'll just.
Dr. Tarun, while you prepare, if you don't mind, I would like to invite Dr. Geeta Prasadni, who wants to actually share her some thoughts with Dr. Aparna. Yes, Dr. Geeta, if you would like to.
Yes, yes. Good afternoon, Aparna. I'm very happy to know that you belongs to state of Andhra Pradesh, especially from the Visakhapatnam. Basically, I'm the gynecologist for the last 28 to 30 years. I know the difficulties, whatever the people now we are suffering in the state of Andhra Pradesh, especially when a COVID positive case mother comes or suspected or like that. Only one thing, Aparna, for you, then you are telling the, but only for the symptomatic. If they are asymptomatic, also there is no need of testing. But most of the cases, what we are getting, especially from the containment zone, where the infection rate is more. This is the only one problem every time the gynecologists and the obstetricians practicing the teaching hospitals, they are asking madam at least to provide a TrueNat machine for us in the OP, at least for the antenatal OP, or otherwise at least when a patient comes with the unbooked case, which is came with a definite history of case coming from the containment zone. This is only one concern of Andhra Pradesh where we are getting. And some of the today only we want to discuss with the, we are having a, especially 225 to 242 TrueNat machines are available now with us. And every time whenever the obstetricians, HODs are there coming and they're asking in our government general hospital obstetrics, we are thinking to keep one TrueNat machine and one with the lab technician where we can get the report at least within 2 hours. This is the main concern, Aparna, for me.
Dr. Aparna, do you have any comments on this?
Actually, sorry, Salima. Actually, I heard the second part of the question.
Sure. So, Dr. Geeta, would you like to share your thoughts once again? Because I think Dr. Aparna was not able to catch the first part of your. Uh,
Dr. Aparna, say good afternoon. Are you able to hear me now?
Yes, yes. Now I can hear you. Yes.
Yeah, there's this thing glad to know that you belongs to Andhra Pradesh, that to Visakhapatnam. We are very happy to be with us today. And not only that, the one of your presentation is very good and very informative, where we are getting day-to-day problems when the cases are coming high and high in state of Andhra Pradesh. Especially last 2 days back when a case came, is a asymptomatic case without having any symptoms. And without you are telling that in a symptomatic case, there is no need of testing. But one of our requests from our gynecologists who are working in our teaching hospitals and the secondary hospitals, they are asking at least to provide us a TrueNat machine at their hospital. When any case comes, if it is asymptomatic or unbooked or any case from the hot spots, that is the red zone area or something like that, because the time is will be very short. When patient comes with a true labor pains, that too, and within 1 hour, 2 hours, she may deliver. And the time at least to take a swab and getting tested whether it is a positive. Duly, we are taking the precautions that the patient is positive only. These are the because day to day all ICMR guidelines day to day they are telling the changing, taking regarding the testing.
Right, right.
Only one concern from my side.
Yes, ma'am. So I would say that currently the status of that is not very clear. We
Yes.
need to understand that. So even if you're providing TrueNat, it comes out to be negative. It will not rule out your infection.
Okay.
right? So to
Let
that
me be.
the solution, you need to, if you're going to provide testing, provide RT-PCR,
Okay.
right? And see,
Yes.
what I also do not agree to the thing that, you know, you should test asymptomatic women. Let me tell you just simple data that out of the 140 women who were suspects, 40 came out to be positive, and most of them were asymptomatic,
Okay.
right? So if it is, because see, and eventually you see, we are testing for HIV for everybody, we are testing for HBsAg for everybody. So eventually during the state of pandemic, if it is such an infectious disease, sooner or later we will move on to universal testing. Most of the states have moved on to universal testing. So if there is a possibility of kits, a state has to decide, right?
Okay.
So
Definitely,
from
Appa.
our data, yes, so from data it shows that there is a high asymptomatic possibility, positivity.
Yes, yes. That is the one more. The infection rate is what they are showing is little more only, but we are getting the case. And soon after the delivery also, we got one case was positive.
So
After
it will
that,
only increase now. So
yes.
we also,
Recently, it happened to be like that when a cesarean section which happened for a previous section. After that, we got the results and the test is positive. Okay, like that. Thank you, Aparna. Thank you.
Thank you, Dr. Geeta. Thank you, Dr. Parna. Dr. Darun, we now move back to the Safe Delivery app and we leave the floor to you. Thank you.
Thanks, Alima. Thanks. So today I am going to talk about this tech platform that is called Safe Delivery app. So in this COVID-19 situation, what is the main challenge we have seen is that providing a standardized information to all the healthcare worker working in the peripheral level. So these webinars are good, but the access is again limited to across the facilities, especially PHCs and the sub-centers. So this app, for this to tackle this challenge, we have developed this COVID-19 module in the Safe Delivery app so that a minimum standardized information on the infection prevention protocols and the MCH care can be shared with all the healthcare workers, even who are working in the peripheral facilities. So yeah. So just a brief about Maternity Foundation. We are working from last 1.5 years in India, and our Safe Delivery app is being integrated in various Government of India's program, including Lakshya. And in India, it was launched in December 2017. So the purpose, what is Safe Delivery app? The Safe Delivery app, basically a mobile phone application. And the main objective of this application is to empower skilled birth attendants, staff nurses, and the healthcare worker working in the MCH care by providing instant access to the standardized protocols. So earlier, the major challenge was to disseminate these clinical protocols in the earlier phase, where we need to print the protocol posters and then pasted those protocol poster into the labor rooms, and the printing of the guidelines is also very difficult at the facility level. So there is one gap in the access of information. So Safe Delivery app, in the Safe Delivery app, we have tried to overcome those challenges. So we have developed certain modules which on which I am going to talk later in my slides. So currently it is used as e-learning tool, job aid, study aid, and even in some of the state it is being used as a mentoring tool, where mentors are using the content of the Safe Delivery app for their mentoring. And also we have a e-learning platform inbuilt in the Safe Delivery app, which is also being used by the trainees for the learning of the knowledge-based learning through some of the questionnaires and getting the certificate in the end on the My Learning certificate. So we have interacted with various users. Currently, we have 70,000 plus users across various states. And the benefits they have shared are that it provides easy and instant access to the clinical material. It is very interactive because we have very short animated videos on the critical protocols. Then in some of the research studies which we have done, it enhanced the knowledge in the nurses. The studies being done in the Bihar, and it shows very positive outcome. Few studies are it is going on in some of the states. Then it increased the confidence. When we interviewed some of the healthcare workers who are working at the PHC level and the health and wellness centers, where which are the delivery points, now they are confident about magnesium sulfate doses. Now they are confident about the PPH initial management. So now to the higher facilities, managed case are going because the staff working in the PHCs and the health and wellness center now have confidence that they know the doses of the drugs and some of the critical protocols. Then it is free. The app is free. Once you download this app, even you don't require you don't need to have internet. All the information will be offline, available offline in your app, in your mobile. So it is free and works offline as well. So right now it is available in 2 languages. We are working on the regional language. Currently it is available on the Hindi and English language. And the government content is aligned as per the Government of India's guideline. And even this COVID-19 module, we have taken reference from available content. And this COVID-19 module is regularly updated for in every 15 days, we update the information if any new guideline is coming. So you get the updated information on your fingertips. So regarding this, these are the modules available right now in the Safe Delivery app. But right now, today, we are only going to talk about COVID-19. And similarly, if you access the information, you can go through all the modules and gain the information about those particular content. But today, as this webinar is for the COVID-19, we are going to talk about COVID-19. So these are the features in the app. It is not only the animated videos. We have action cards. We have practical procedure. We have drug list. We have an e-learning platform where you can get a certificate based on your knowledge. And this certificate is being inbuilt in the Lakshya program as well as in the midwifery program. So in the videos, we have 10 to 12 minutes video for each and every module, maximum 10 minutes video. And these videos are again divided into the sub-chapters. Then we have action cards. The critical action you need to be taken during a particular emergencies, like in case of PPH, you should know, every health worker should know how to refer a case of PPH. What action needs to be taken, what drugs needs to be given. These are enumerated in these action cards. Then the practical procedure, the critical practical procedure like uterine balloon tamponade, how to do intravenous access equipment, urine catheter. Every practical procedure is being summarized in these headings under the practical procedure of the module. So in the COVID-19 module, the practical procedures and the action card are also related to COVID-19, like breastfeeding, triaging of a pregnant woman, how to do breastfeeding, then how to make 1% sodium hypochlorite solution, dunning, duffing. Everything is being summarized in these particular subchapter in these headings, action card and practical procedures. Then we have a e-learning platform that is called My Learning Platform. We have more than 14,000 staff nurses enrolled at this platform and from the public health facilities. So these platforms provide you a chance to get a certificate based on your knowledge through Maternity Foundation and the University of Copenhagen. And it also being integrated into the Lakshya program. So we have around 2,000 plus Safe Delivery app champion. And even in Andhra Pradesh also, we have around 11 champions on this particular platform. And we have around 600 users from Andhra Pradesh on Safe Delivery app. Regarding the drug section, we have line listed all the drugs which are essential and required in that particular emergency. For COVID-19, we don't have this feature because till date no particular drug is being authorized by Government of India. So this section is not applicable to COVID-19. However, other than that, for the PPH, AMTSL, manual removal of placenta, sepsis, neonatal resuscitation, hypertension, every module you will get this section where you can see entire detailing of the drugs required for that particular emergency. So, how to download Safe Delivery app? I request all the audience who is right now using is attending this webinar. Please follow this process. This is very easy. just go to your Play Store, search for Safe Delivery app, and choose the language version. It is very critical. Please select only India English and India Hindi. There are one more version on English, which is a global version, but our guidelines are a little bit different from the global community. So we have adapted our animations and the guidelines and the content as per Indian guidelines. So please select India English version, and then select country, state, district, and there is a small survey about your profile, where are you working and all those stuff, so that we can give a regular information to the state about the downloads and about the district performance on the My Learning platform, as well as on the number of users, which we will provide after this presentation. Every 15 days we will be providing data to state team, that how many downloads and how many certificates has been generated in each and every district of the Andhra Pradesh. So this is the COVID-19 module structure of the COVID-19 module. It is divided into three things. First is video, animated video, practical procedure, and the action card. I will just take you through this small video. So this is the COVID-19 module. I have circled it in red. It is the first module of the app. Then if you click on that, you have these features. First is video, action cards, practical procedure, and the My Learning platform, where you can see the knowledge, access your knowledge. This is the video. It is a 6-minute video for COVID-19 module. This is the action card. This is the assessment of pregnant women, which is being told by Dr. Aparna Sharma. We have actually want to acknowledge her, that we have taken this from her content only, that this is the assessment for pregnant women, how to do a triaging. And after that, practical procedures. If you click on the practical procedure, or the critical practical procedures are being summarized in each and every tab. So you have breastfeeding, care during pregnancy, vertical transmission. So this is the breastfeeding. So in this way, we have, you can see, we have summarized the information which is necessary and to be told to the healthcare worker working in the labor room. Similarly, dunning and duffing, how to wear the PPE and how to remove the PPE. We have done we have summarized entire information in this particular module. So now I will take you through the key component of our video. So we have, in the video, we have given stress on the key infection prevention control practices to be followed in the facilities during this COVID-19 outbreak. So first and foremost is the hand hygiene, then the respiratory hygiene, then the how to wear personal protective equipment and what to wear, then disinfection, then environmental cleanings through sodium hypochlorite, waste management, how to handle biomedical waste management as per the amendment rule, particularly for the safe for this COVID-19 case. Government of India has issued separate guidelines, and we have converted into animated video. So now we will see the video. This is for 5 or 6 minutes. We can see this video, and then you can see how useful it is. If you feel useful, please share it. Please share this app across the district.
Infections are caused by invisible germs. These infections can be prevented. 5 steps to prevent COVID-19. 1. Hands. Perform hand hygiene frequently. 2. Elbow. Cough or sneeze into your sleeve or a tissue. 3. Face. Avoid touching your eyes, nose and mouth with hands. 4. Distance. Keep at least a 1 meter distance from others. Avoid physical contact, for example, shaking hands, hugging. 5. Feel. If you feel unwell, stay home. Hand hygiene. Perform hand hygiene before and after every procedure, even when hands are visibly clean. Wash your hands with soap and running water or use alcohol-based hand rub. Use hand rub when hands are visibly clean. Germs can hide. Always have short fingernails and do not wear nail polish, artificial nails, rings, wristwatch or bracelets. Procedure for hand wash. Wet hands with clean, running water. Use liquid soap from a dispenser. If not available, use plain, dry and visibly clean soap of small size. Germs will grow in wet, dirty soap. Apply soap. Vigorously rub all areas of hands and fingers together for at least 20 seconds, especially between fingers and under fingernails. 40 to 60 seconds for entire process. Rinse hands with clean running water. Close the tap with your elbow or tissue paper. Use paper towel to dry hands. If not possible, use a clean, dry towel, but make sure the towel is clean and has not been used by you or others before. A shared towel that has been used multiple times by multiple people quickly becomes contaminated and can transfer germs to your hands. Procedure for hand rub. Apply a palmful of hand rub to cover the entire surface of hands and fingers. Rub the solution vigorously into hands, especially between fingers and under fingernails until your hands are dry. Complete process takes 20 to 30 seconds. See procedure on how to make alcohol-based hand rub. When to perform hand hygiene. Before and after each patient contact. After contact with patient's surroundings. Before a clean procedure. After body fluid exposure risk, including after using toilet, and before wearing and after removing gloves. Personal protective equipment. When entering a room with suspected or confirmed COVID-19 patient, wear the following personal protective equipment. 1. Head cap. 2. Shoe cover. 3. Gloves. 4. Long-sleeved full covering gown. 5. 3-layer mask or N95 mask. 6. Eye protection goggles or face shield. Take off personal protective equipment.
So you can see the similar videos are being prepared for, such videos are prepared for other modules as well. And you can have this entire information on your mobile app. So apart from this hand hygiene and PPE, you have biomedical video on the biomedical waste management and also on the sodium hypochlorite solution and the environmental cleaning. So we have also prepared such videos for other clinical protocols like PPH, hypertension and other clinical things which are essential, protocols essential in the labor room. So the next thing is the My Learning platform. It is an e-learning platform, which is basically a platform which enable you to assess your knowledge. So you can, by using this e-learning platform, you can get this certificate, which is being shown in the picture, and also a badge is being proposed by Government of India. Whosoever has achieved this certificate can get this badge, which is being given through government budget, and it is a guideline also being shared by Lakshya PMU on this. So this My Learning module has been divided into 3 levels. First level is familiar level, where easy questions, relatively simple questions are there. Second level is proficient level, where you will little bit difficult question, and the expert level you will get more difficult question. To move to next level, user need to pass the previous level with the 100% mark. And almost in each and every level you will get around 12 questions, and once you get expert level in each and every module, all the 11 modules, there is a exam got Safe Delivery Champion exam that will get unlocked. and that is a case study based exam. And if you score more than 70%, you will get a certificate from Maternity Foundation, and which is for that particular certificate, reporting is also being included in the Lakshya portal as well. So we have around 14,000 mile learners on this platform, and many have achieved. Around 2,000 plus public health nurses posted in the public health facilities have already achieved this certification. So this was my presentation. Just few comments that all the critical information which is being given in this particular webinar and required for the COVID-19 can be accessed through this Safe Delivery app. And also, as one programmatic input is that as all the trainings are on halt right now, maternal health and child health training, I request that state can implement the Safe Delivery app. Meanwhile, once till this trainings are not resumed, and as an outcome basis, the Safe Delivery app champion certificate can be used as an outcome for those trainings, that everyone should achieve this certification in particular state. Hope this app and this platform will help you in disseminating information till PHC level on this COVID-19 and other labor room protocols. Thank you so much.
Thank you, Dr. Tarun. I'm sure this app will actually serve as a very, very useful tool at the ground level for PHCs, for staff in PHCs and in other health facilities. And I think we will all aspire to come to your, to achieve the certificate at the earliest. Dr. Aparna and Dr. Geeta, if you are okay, can we take a couple of questions now?
Yeah.
Yes, I'm ready, ma'am.
Yes, thank you, Dr. Aparna, thank you, Dr. Geeta. So the first question is actually to Dr. Aparna when they are in labor room. That's the question that has been asked.
See, it is actually up to the availability now that we are not doing universal testing. So we have to, really be prepared, and it is a respiratory virus. And because labor and delivery is a procedure it is preferable, but if it is not there, then at least a 3-ply mask with a face shield should be available, should be used. We need to remember that the second stage of labor is an aerosolizing procedure. So we need to prepare accordingly.
Right. Thank you, Dr. Aparna. Dr. Geeta, we have a couple of questions on the programmatic front. I'll just quickly share 2 or 3 of them, and then maybe we can answer them right away, or we can answer them as we go forward. We can even reply to them via email. So first is that should COVID pregnant women deliver only in civic hospitals, or do you expect them to be delivered across all levels of facilities?
No, not at all. All the COVID positive pregnant ladies should be delivered only in the designated hospital where all the facilities are made, even it is a normal delivery or by the LSCS.
Right. So that's very clear. We should refer pregnant women to civic hospitals for COVID positive pregnant women to civic hospitals for delivery. Second is that where should we send antenatal patients for COVID testing?
Actually, that is the one plan. What we have done is every PHC medical officer, now it is trained. They have to do the COVID positive test for the, especially for the EDDs in this month ending and the June first week. And then in the urban area where we are planning to have in the MAG center, the rapid response teams with the mobile RRT will go and take the collection the samples. That is the plan what we have done here.
Right, Dr. Geeta. So the next question actually comes from, really comes from there only, that where should we send patients for testing from private clinics in West Godavari? This is a specific question from West Godavari.
Actually, it was, I have seen that question in West Godavari, where we have to just think, I'm just after getting the question, I'm just thinking of myself in a hospital where there is a TrueNat machine where I don't know exactly which is available, but the places where we are having the 2 places where the West Godavari is designated, just where it is actually, that is District Hospital Elur and the Area Hospital Tadepalligudem and CHC Bhimavaram. These are the 3 hospitals under the APVP side. those hospitals are already having the TrueNAT machine.
Right, ma'am. There is just one request, not a question, but a request that all field staff must,
Get tested.
yes, and all field staff should also be helping in making sure that pregnant women are tested by 38 weeks, because it becomes difficult for the teaching hospitals to actually perform the test in heavy rush. So if they are tested before they are referred, that's the kind of request that is coming from the field. Uh, Dr.
Definitely,
Geeta,
definitely, we'll take that one also. We are thinking of that one also. We are already having a plan to discuss with the Director of Medical Education, where the teaching hospitals, we are getting very often the calls from the teaching hospital, HODs from the gynec. That's why we are having that plan of keeping one TrueNAT machine in the entrance of the admission itself to test the patient comes with the labor or at 38 weeks or from the containment zone. Even she's asymptomatic.
right, right, ma'am. Thank you, Dr. Geeta. So I
Thank
think,
you. Thank you.
thank you. So I think we've had like a good question answer session. There are other questions which we may take on at a later stage, if possible. We would like to first launch the post training polls, and I request you all to share your feedback via the polls. Uh, we are starting with the post training polls. Your feedback polls, they are very important to us. So, and while you all actually respond to the polls, may I take this opportunity to invite Dr. Sanjeev Upadhyay, who was actually the person who made this training possible. It was his idea that we should focus on COVID-19 and pregnancy trainings in these three states. So may I invite Dr. Sanjeev, the health specialist from UNICEF. Dr. Sanjeev.
Thank you, Dr. Salima. So at the outset, I would like to thank Dr. Aparna Sharma for making herself available for this training program. I was very glad to learn that she is from Visakhapatnam. I just want to check with her if she can speak Telugu also fluently. And if that is the case, we can use her expertise more often.
Yes, I can speak Telugu.
Fantastic. Fabulous, Dr. Aparna. Today, apart from many of you who could become part of this presentation or the session, we miss Dr. P.V. Ramesh, our Additional Chief Secretary, who got stuck at Chief Minister's meeting and we could not hear him out. But I'm sure in future, he committed that he will try to participate and address all of you. Just for Dr. Aparna's understanding, this TrueNAT is something which is very specific to Andhra Pradesh. It is a point of care molecular testing method, which largely is used for screening purposes. The advantage is that it's very quick. You get your test result within few hours when you compare it with RT-PCR, which takes much long. But RT-PCR remains a gold standard test. But Andhra Pradesh currently using TrueNAT to not only for screening, but also largely for the cases who they want to test for COVID. This means beyond screening. And our additional director MCH, she can confirm if all positive cases are also tested on RT-PCR. So another third thing, and that's my last point to all the speakers, because we are very close to lunchtime, and many of you, if you are at your homes or you are at clinic, we have additional responsibility to feed children and the family. So I'll be very quick on my last point. Most of us went through this very interesting paper from Lancet, which clearly tells that due to COVID-19, we'll be losing additional 2.5 lakh children, around 12,000 women in low and middle income countries. However, we can avoid it provided we put certain measures in place. And these are very simple and easy ones. Madam and also Dr. Parna spoke during their speeches. We need to ensure that essential services are available to all pregnant women and newborn. We need to ensure that the referral services are available to those pregnant women who are in emergency situation. We also need to track and follow up all high-risk pregnant women. Immunization services should remain available to all pregnant women as well as to all kids. And in no condition any woman or newborn should be denied services in any conditions, whether it is a COVID or non-COVID situation. So these are some of the things I want you to take these as your take-home message, and to see that we continue spectrum of or the complete RMNCH plus A services in our districts, in our primary health centers, in our community health centers. And I think that's the way to move ahead. And I'll close my closing remarks with a point that this is just a beginning from UNICEF side. In future, we'll come out with more specific issues which are concerning your day-to-day practices during COVID. So I thank Dr. Geeta and the whole team at Office of Commissioner of Health and Family Welfare. My specific thanks to Dr. Parna Sharma, who could make herself available for today's important session. And last but not the least, all participants from health facilities all over the state. So thank you, and over to you, Dr. Salima.
Thank you, Dr. Sanjeev. Dr. Tejaram is also, we are very happy to share that Dr. Tejaram has stayed with us throughout this entire, 2-hour training, and I'm sure we will hear good things from him. Dr. Tejaram, would you like to share some feedback at this point?
We had very good webinar and nice presentations and very fruitful discussion and deliberations. I hope we will get benefited and we will carry forward this kind of training onwards also. Thank you so much.
Thank you, Dr. Tejaram, and thank you, Dr. Sanjeev. And with this, I think I would like to thank the audience for actually being with us throughout. We hope that your questions are answered. If there are certain questions that are remaining, we will try to respond to you via email. I request you all to continue. Before you leave, just share your feedback via the poll. And if permitted, I would like to close the session for today. Thank you. Thank you. Dr. Nagendra, anything else that you would like to
Salima.
share? Yes, Dr. Geeta.
Salima, thank you, Salima, for taking all this initiative and making this webinar as a grand success. Thank you, one and all.
Thank you, everyone.
Especially thanks for the Aparna madam and the Tejoram sir and the Sanjeev Upadhyaya. Thank you, one and all.
Thank you, everyone.